Hello dear friends, now I am going to teach you the very big topic of the anatomy, which is called head and neck. So first of all we will start from the four basic topics of the head and neck, and after that we will go in the detail. So I will start from the cranial fossae and cranial foramina, and after that we will learn the temporal mandibular joint along with the muscles of mastication, and also the tongue topic along with the dural venous sinuses. Actually, after these four topics, definitely you will be learn the cranial nerve. Please directly don't jump on the cranial nerve, because definitely you will not be able to keep in your memory for long time, for long duration. If you will learn conceptually, then you will be able to hold the whole topic for the long duration. So first of all we will start from the cranial fossae. So this is the anterior cranial fossa. इसमें anterior cranial fossa. Okay, this is the middle cranial fossa, and here the posterior cranial fossa. I think you all are able to see in these fossae some openings are present, and these openings is called foramina and fissure. Foramina and fissure. Okay, so I will teach you all the foramina, all the fissure, and all the structure which is passing through these openings. I want to make here, this is the cranium, this is the cranium part, and this is the body of sphenoid, this is the body of sphenoid, and from here I am making this line which is laser wing of sphenoid, and this line is a apex part of the temporal bone. This is the apex part of the temporal bone. Okay, this is the apex part of the temporal bone. So please try to understand, these are the fossae. This is the anterior cranial fossae, posterior cranial fossae, and middle cranial fossae. These are the fossae of the cranium, middle cranial fossae. Okay, this is the very basic to understand. First of all you should know about the fossae, and after that definitely we will go in the openings which is present in the fossae. Okay, fossae have a lot of openings known as the foramens, and many structures passing through these foramens. So now let's see all those foramens one by one, and what structure passing through this. So please come on this new picture, new diagram, and here we will try to learn on all the things. Okay, so I think you all are able to see this part. This is called cribriform plate. Cribriform plate. Cribriform plate. So please tell me the what structure passing through this cribriform plate. Actually, the first cranial nerve, which is also called olfactory nerve, this is passing through the cribriform plate. Okay, this is responsible for the smell. Please try to understand. Here I want to create the base only. I want to tell you all the things in very easy manners, and after that we will go in the detail of every structure of every foramina. Okay, so please don't be panic. Okay, and after this cribriform plate, I think you are able to see this first of all I want to tell something about the bone. This is the frontal bone, okay, and this part is sphenoid bone. So this is the L, lesser wing of sphenoid, okay. This is body of sphenoid, this is body of sphenoid, and this is greater wing of sphenoid, which I have made G. This is greater wing of sphenoid. Actually I want to tell you, first of all we should create a orientation. We shouldn't forget about the orientation, actually what we are watching. So I want to create some orientation. I want to tell you when I will cut my skull in the transverse section and remove the skull vault, and after remove the skull vault I remove the brain and throw out, and from the above I will see, the skull base, the base of the cranium. I will see the skull of base. From above you will able to see these complete structure, okay. So first of all in front I think you are able to see this. This is the frontal bone, anterior cranial fossa, so this is the frontal bone, and after the frontal bone I have written to L, and these L mean the lesser wing of sphenoid, and this is B, it mean body of the sphenoid, and this is the G, mean greater wing of sphenoid. But when you tilt the skull base, and after that this is the lesser wing of sphenoid, this is the greater wing of sphenoid, and in between this you will see a structure, you will see one opening, okay, which opening, actually this opening is called the superior orbital fossa. This opening is called superior orbital fissure. I think you all are able to see this area. This opening is called superior orbital fissure, okay. But before that, at the level of body, I think you all are able to see this part, this opening is called optic canal, okay. At the body part, this is the optic canal. So first of all I will write here the optic canal. I will write here the optic canal. Can you tell me which structure passing through the optic canal? So optic mean optic canal and optic nerve. The optic nerve passing through the optic canal. Optic nerve means second cranial nerve passing through the optic canal along with the ophthalmic artery. Along with the ophthalmic artery. Ophthalmic artery. Along with ophthalmic artery. Ophthalmic artery, which is a branch of internal carotid artery. Ophthalmic artery is a branch of internal carotid artery. This is the branch of internal carotid artery. So we have learned about the cribriform plate, which is a part of ethmoidal bone, okay. And through the cribriform plate, the structure passing, which is called olfactory nerve, first cranial nerve, and after that, just try to understand, everything is in a proper sequence. After that, the optic canal is present. So here I think at the level of body, you can see this is the optic canal, and through the optic canal the passing structure is second cranial nerve, which is called optic nerve, along with ophthalmic artery, which is a branch of internal carotid artery. And after this, the third opening, which I have told you also, in between the lesser wing of sphenoid and greater wing of sphenoid, in between there is a fissure present, which is called superior orbital fissure. So I will make here, this is the superior orbital fissure. Superior orbital fissure. I will write here in a black color, superior orbital fissure. And now I want to tell you what are the structure which is passing through the superior orbital fissure. But before that, I want to tell you one thing to make the proper concept. I think you all have listened the famous formula in all over the world, Lr6SO4. What? Lr6SO4. So I want to write here the Lr6SO4, rest all by third, rest all by third. Okay, what is the meaning of this? So just try to understand. From the superior orbital fissure, when you will see the skull base, from the superior orbital fissure, the structure entering in the orbital, in orbit, which is present, which structure is present in the orbit, which is a eyeball, and eyeball is surrounded by six extraocular muscles. 6 extraocular muscles mean superior rectus, inferior rectus, lateral and middle rectus, and 2 oblique rectus, superior oblique and inferior oblique rectus muscle. Okay, superior oblique muscle and inferior oblique muscles. These 6 extraocular muscles which help to move the eyeball. Okay, and these 6 extraocular muscles are supplied by LR6, mean lateral rectus is supplied by 6th cranial nerve. SO4 mean superior oblique muscle is supplied by 4th cranial nerve. 6th cranial nerve is a abducent nerve, and 4th cranial nerve is a trochlear nerve, and all rectus muscles are supplied by 3rd cranial nerve. All supplied by 3rd cranial nerve. Okay, supplied by 3rd cranial nerve. So I want to talk about the superior orbital fissure. So these nerves are going in the orbit and passing into the orbit through the superior orbital fissure. So what are the structure which is passing through the superior orbital fissure? We have got some structure here, which are structure 3rd cranial nerve. Let's use black color, red color. 3rd cranial nerve and 4th cranial nerve, and 5th also I will tell you how. 5th cranial nerve also, but I will tell you how and which branch of the 5th cranial nerve. Okay, and 6th cranial nerve, and 6th cranial nerve. Okay, and 6th cranial nerve. Now I want to tell you how the 5th cranial nerve passing through the superior orbital fissure, and which branch of the 5th cranial nerve, which branch of the trigeminal nerve passing through it. Okay, so first of all I want to tell you 3rd, 4th and 6th, they completely pass through the superior orbital fissure. And if I will talk about the trigeminal nerve, the 5th cranial nerve, there are 3 branches of the trigeminal nerve like this. the ophthalmic branch and the maxillary branch and mandibular branch. So the three branch of the trigeminal present. Okay, and the ophthalmic branch, which is called V1. Okay, I want to write here to make better understanding. Fifth cranial nerve. Okay, fifth cranial nerve. It gives the three branch. Okay, it gives the three branch. Number first V1, V2, V3. Ophthalmic nerve and maxillary and mandibular. Mandibular nerve. The trigeminal nerve divided into three main branches. Okay, so through the superior orbital fissure, because it is entering into the orbit in ophthalmic area, that's why the ophthalmic branch passing through the superior orbital fissure, mean the V1 passing through the superior orbital fissure, V1. Okay, V1 passing through the superior orbital fissure, which is the branch of ophthalmic nerve, which is a branch of trigeminal nerve. Okay, and also in detail when we will learn about the cranial nerve, then also we will learn the V1 is not only the V1 directly enter into the, just before entering in the superior orbital fissure, just before entering, we can say here it is also divided into three branch, like nasociliary, lacrimal and the frontal. Okay, so we will, when we will learn in the detail about the cranial nerve, then we will definitely learn all the things. Okay, but just now you should know what are the structure which is passing through the superior orbital fissure. The third cranial nerve, fourth cranial nerve, fifth cranial nerve, only V1. Okay, the first branch of the ophthalmic branch of the fifth cranial nerve and the sixth cranial nerve. Okay, these structure passing through the superior orbital fissure. And after this, the next opening, I think you all are able to see this, the next opening, which is called foramina rotundum. This is the foramina rotundum. So I will write something here. This is the foramina rotundum. Okay, foramina rotundum. Okay, this is foramina, I will write only F, foramina rotundum. Foramina rotundum. Okay, foramina rotundum, and which structures passing through the foramina rotundum, I will write from the right color here. Okay, already I have told you this is the very sequence, these all things are present in very sequence way. Okay, in a very good pattern. So you know already we have learned about the fifth cranial nerve, trigeminal nerve. The V1 is passing through the superior orbital fissure, and V2 maxillary nerve. V2 mean the maxillary nerve. V2 the maxillary nerve. Okay, V2 mean the second branch of the trigeminal nerve. V2 mean maxillary nerve. Maxillary nerve. This is passing through the foramina rotundum. Okay, this is passing through foramina rotundum, and after the foramina rotundum, you will see here the new opening, the next opening, which is called foramina ovale. You will learn here, this is the foramina ovale, and after this foramina ovale you will see the foramina spinosum. But first of all we will learn about the foramina ovale. In the foramina ovale, foramina ovale. Okay, foramina ovale. Which structures passed through the foramina ovale? So I will tell you something. Foramina ovale mean male. Male. Ovale, male. This is the mnemonic to learn which structure passing through the foramina ovale. So I have told already about the two branches of the fifth cranial nerve of the trigeminal nerve. Number first is the ophthalmic nerve, which is passing through the superior orbital fissure, and after that I have told you also about the foramina rotundum, and the V2 mean the second branch of the fifth cranial nerve, which is passing through the foramina rotundum, and the third branch of the fifth cranial nerve, the third branch of the trigeminal nerve is passing through the foramina ovale, which is called mandibular branch. V3 mean the mandibular branch. Mandibular branch. Okay, a mandibular nerve. It is passing through the foramina ovale, and after that from the foramina ovale some other structure is also passing. What are that? The accessory meningeal artery. A for the accessory meningeal artery. Okay, meningeal artery, accessory meningeal artery. Okay, and after that from the L mean the lesser petrosal nerve. L, lesser petrosal nerve, and the last one E for emissary vessels, emissary veins. Emissary veins. Okay, so these are the structure which is passing through the foramina ovale, which is passing through the foramina ovale. Okay, foramina ovale. The first is a cribriform plate, from where the first cranial nerve is passing through that, and after that the optic canal, and through the optic canal optic nerve is passing along with ophthalmic artery, and after that, after the optic canal, you will see here the next superior orbital fissure, and from the superior orbital fissure, as I told you, the many structure is passing through it. Number first, superior orbital fissure, I have told you a formula also, LR6SO4 rest all by 3. The third cranial nerve, fourth cranial nerve, fifth cranial nerve, V1 part of the fifth cranial nerve, the first branch, which is called the ophthalmic nerve, which is branch of the trigeminal nerve, fifth cranial nerve, which is called V1. This is passing through the superior orbital fissure, and sixth cranial nerve also passing through the superior orbital fissure. Okay, and along that also the V1, which I have told you also, V1 ophthalmic artery, ophthalmic nerve is also passing through the superior orbital fissure, and the one more structure which is called ophthalmic vein is also passing through the superior orbital fissure. Please note down it in the superior orbital fissure, which are structures are passing through the superior orbital, ophthalmic vein is also passing through the superior orbital fissure. Okay, please write down it. And after that we have seen, after the superior orbital fissure, we have seen one more foramina, which is called foramina rotundum, and from the foramina rotundum the structure is passing through the foramina rotundum is called V2. V2 mean the second branch of the trigeminal nerve, which is called, the second branch of the trigeminal nerve is called maxillary nerve. Maxillary nerve. Okay, and after the maxillary nerve, from the foramina rotundum, after the maxillary nerve, from the foramina rotundum, after the maxillary nerve, from the foramina rotundum, passing the maxillary nerve, and after that we have got the new opening which is called foramina ovale, and from the foramina ovale you can see the many structure passing through the foramina ovale. Okay, so we have made a mnemonic. This is the mnemonic male. The first M mean V3, mandibular nerve, which is a branch of trigeminal nerve, and the accessory meningeal artery, and the lesser petrosal nerve, and emissary veins. These are the structure passing through the foramina ovale. And after the foramina ovale we have got the new opening, which I think you all are able to see. This is the new opening, okay, which is called the foramina spinosum. Foramina spinosum. Okay, so I want to tell you something about the foramina spinosum. What are the structure which is passing through the foramina spinosum? So just try to understand about this. This is the foramina spinosum. I think it is a very funny way, but I want to tell you. Spinosum mean the spinal cord for the what? Dura mater. Why I am saying this is the spinal cord for the dura mater? Because the structure passing through the number first, spinosus, nervus spinosus, which is the chief nerve to supply the dura mater, and after that the middle meningeal artery is passing through the foramina spinosum. It is also the chief artery to supply the dura mater. Okay, to supply the dura mater. Middle meningeal artery is a chief artery to supply the dura mater. Okay, so I want to write here the nervus spinosus and middle meningeal artery. Okay, these both structure, the chief nerve and chief artery, to supply chief nerve, chief artery to supply the dura mater. Okay, so there is a one MCQs we can ask, the examiner can ask you, which artery is responsible for produce the EDH, extradural hemorrhage, yeah, epidural hemorrhage. So the middle meningeal artery, when the middle meningeal artery is ruptured, this produce the extradural hemorrhage or epidural hemorrhage. Okay, and after that I will tell you also about the subdural hemorrhage in next topic, but before that you should understand it. And after this opening, I think you all are able to see this. This is the area, this is the opening, new opening or new area we can say. Okay, this is particularly this area. This is called internal acoustic meatus. This is called internal acoustic meatus. So what are the structure passing through the internal acoustic meatus? So this is the structure which is passing through the internal acoustic meatus is 7th cranial nerve, mean facial nerve, and 8th cranial nerve, mean vestibulocochlear nerve, 8th cranial nerve. These structure passing through the internal acoustic meatus along with the labyrinthine vessels. So please note down it, labyrinthine vessels. Okay, please note down is completely in your copy book. Okay, notebook. Labyrinthine vessels. So internal acoustic meatus, and the structure passing through the internal acoustic meatus is a facial nerve, which is 7th cranial nerve, and vestibulocochlear nerve, which is 8th cranial nerve, and labyrinthine vessels. And after that, near to the inferior acoustic meatus, you are able to see this very big opening, which is called jugular foramen, jugular foramina. Okay, So what are the structures passing through the jugular foramina? Please note down it. Okay, please note down it. Jugular foramina. What are the structure passing through the jugular foramina? Number first, ninth cranial nerve, 9th, 10th, 10th cranial nerve, 11th cranial nerve, 11th cranial nerve. Okay, and these are the structure passing through the jugular foramina, and two more structures which is called the inferior patroclear sinus and sigmoid sinus. Inferior patroclear sinus and sigmoid sinus. Sigmoid sinus. Please note down in your copybook complete name. Please don't write short form. Okay, inferior patroclear sinus and sigmoid sinus, both meet together after just passing through the jugular foramina. Both meet together and form here a jugular vein. Jugular vein. Okay, this form the jugular vein. Okay, so what are the structure which is passing through the jugular foramina? 9th cranial nerve, 10th cranial nerve, 11th cranial nerve, and two sinuses also, inferior patroclear sinus and sigmoid sinus, and both sinus meet together, join together and form a jugular vein. Okay, and form a jugular vein. I think here you are able to see in just at the edges of foramina magnum, you are able to see this new opening, this opening which is called hypoglossus canal, which is called hypoglossus canal. Hypoglossus canal. Okay, and what structure passing through the hypoglossus canal? This is, which is the hypoglossus nerve, which is called 12th cranial nerve. 12th cranial nerve. Okay, 12th cranial nerve, which is passing through the hypoglossus canal. Okay, and this is the very big opening. This is the very big opening. Okay, this very big opening is called foramina magnum. Foramina magnum. Okay, and what are the structure passing through the foramina magnum? This is very interesting question, because at the level of first year MBBS, the mostly students says the spinal cord passing through the foramina magnum, but it is not correct. It's a very big blunder mistake. Okay, then what are the structure passing through the foramina magnum? Then these are the medulla oblongata. Medulla oblongata. Actually the spinal cord is starting from the C1 level. Okay, so medulla oblongata passing through the foramina magnum. Okay, and along with the medulla oblongata, the branches of anterior spinal artery and the posterior spinal artery. Okay, anterior, the vertebral artery passing through along with the medulla oblongata. Okay, okay, and two branches of the vertebral artery like spinal artery, anterior spinal artery and posterior spinal artery. These are passing through the foramina magnum. So here I will write also the vertebral artery. Okay, vertebral artery is also passing through the foramina magnum along with the medulla oblongata. Okay, medulla oblongata with two branches, anterior and posterior spinal artery. Okay, again I want to tell you, the spinal cord start from the C1, does not pass through the foramina magnum. Okay, but I want to tell you one more structure also, And what is this structure? This is called apical ligament of Dens. Apical ligament of Dens. Apical ligament of Dens. With one more structure is also passed through the foramina magnum, which is called tectorial membrane. Just try to understand, everything is going into the through the foramina magnum, like medulla oblongata, like vertebral artery, along with the anterior and posterior spinal artery, okay, with two branches, vertebral artery with two branches, okay, entering, and the apical ligament of the Dens also, and these all are covered with the membrane, we can say, just to further learn, okay. And this membrane is also going, which is called the tectorial membrane, which is called the tectorial membrane, tectorial membrane, okay. So these are the structure which is passing through the foramina magnum. Don't forget these, just try to learn, or don't try to mug up only in a table, okay. In one side you will write the foramina, and next side you will write what are the structure passing through. Just try to learn with the help of image, because you should be identify at the structure. What is the foramina magnum, what is the foramina ovale, what is the foramina spinosum, what is the foramina rotundum, and what is the foramina spinosus. Everything you should know at the structure, okay. Many image based questions also present, that's why you should know, you should be identify, okay. You should be able to identify all the structures, okay. That's why don't try to learn in the table form, just try to learn at the diagram. But I think here one more foramina, one more opening is here. You all are able to see this. This is the this part. This is the foramina lacerum. This is the foramina lacerum. So I will write here about the foramina lacerum, okay. Foramina lacerum. What are the structure passing through the foramina lacerum? Actually, through the foramina lacerum entering the one structure which is called internal carotid artery, okay. But can you tell me the complete, throughout the complete foramina lacerum the internal carotid artery is passing? No, because internal carotid artery is entering through the carotid canal. How? I will tell you. From the below side you will see like this. This is the bone. I will not go into the detail of the bone very much, okay. This is the bone. I should make it with the black color. This is the bone. Okay, and from here the internal carotid artery entering in the carotid canal and taking a bend and going toward the foramina lacerum. So this is the foramina lacerum, foramina lacerum, and here this area is closed with the cartilage. This area is closed with the cartilage, okay. This area is closed with the cartilage, and this part is called carotid canal. This area is called carotid canal. So the carotid artery, internal carotid artery entering into the skull base through the carotid canal, and after that reaching to the cranium area through the foramina lacerum, okay. And I think you all are know about this thing. Here you will see a plexus, nerve plexus. You will see a nerve plexus around this, okay, around the complete this area, nerve plexus, which is called sympathetic plexus of nerve, which is called sympathetic plexus of nerve. Sympathetic plexus of nerve. From here begins the deep petrosal nerve. Please don't forget about it. From here begins the deep petrosal nerve. Deep petrosal nerve is beginning from the foramina lacerum or carotid canal. From the area you should learn about it. Okay, so from this area, from the sympathetic plexus of nerve, from here begins the deep petrosal nerve. Okay, from here begins the deep petrosal nerve. Don't forget about it. In the next video we will go into the detail, okay, of every structure one by one. But please don't be panic what you have understand or what you don't have understand, okay, because it is the just preparation for learning the topics. Okay, and we will also learn 2 to 3 times. Okay, and we will also recall it at the home, and after that definitely we will start from the next topic. Okay, thank you.